Welcome back. Tonight in your program we're going to have a very interesting guests. Tonight we have two in-house coming from long way from United States. Professor Antoine Kaldany, who is the head of International Office of Joslin Diabetes Center of Harvard University. And he works in Diabetes Center, which is most prominent in the world. And Professor Richard Schwartzstein, who's worked as a professor of medicine in Shapiro Institute for Education and Research. And he's also a pulmonologist, and we're going to talk about, part of, chronic diseases, education, and diabetes. Welcome in Kuwait.
Thank you.
Thank you. Now, you're in Kuwait to join the conference, which can happen in Dasman Center under the patronage of His Excellency Sheikh Nasser Sabah Ahmed Sabah, our Minister of Amiri Diwan Affairs, and it's part of the research priority of diabetes and other chronic diseases conference, which happening in Dasman Center, which is, I think it's reborn again to start to work in a different way. So how did you like the weather?
It's a lot warmer than Boston.
Yeah.
Which is nice.
Good, very good. So I'll start with you, Professor Richard Schwartzstein. You're a pulmonologist and you work in one of our, the best institutes for education. Tell us about the role of education for people.
Well, we were talking before about chronic diseases and whether it's asthma or diabetes. Managing patients who have a chronic disease is more than just about the science of the illness itself. Patients have to be involved in the management of their own problem. And that requires the doctor to be able to communicate effectively with the patient's family about things that will make the disease worse, the best ways to use their medications, things to look out for that may cause them problems. And if you don't do that part, it's often very difficult to really keep the chronic disease under control and have the individual be as functional and active as they possibly can.
So for many years, medicine in general have been on the shoulders of physicians. Now you're saying you're going to take part of that and put it on the shoulder of the patient himself.
That's right. That for the disease really to be managed well, the patient has to play a role. They have to have a partnership with the doctor. There may be parts of their management that's just difficult for them. And the doctor has to be able to ask about that, understand that, perhaps make modifications in the treatment so that the patient can actually follow through on all the recommendations and then do the best they can to keep the disease under control.
And in your center, what kind of facilities do you provide to implement this kind of theory?
Well, the notion is that doctors don't necessarily come by these communication skills by accident, or that they're just born being able to do that. So one needs to train them about communication. And so we do everything from specific teaching about how to interact with patients to having them do simulated conversations with what we call standardized patients, to actually having them be observed by more senior doctors when they interact with patients. So we give them feedback, we give them training, and make sure that they use the right language and interact in the most effective way with the patients and family.
And Professor Kaldany, you work in one of the best centers in diabetes in the world. And how do you see diabetes in our country?
Well, the first thing I could say is there is a lot of it. Diabetes is a rampant epidemic worldwide. In this region, according to some projections and statistics, it's expected to triple in the next 20 years as number of patients total. This is part of the problem. The other part of it is starting to affect the younger and younger ages. And this may be triggered by bad eating habits, increased number of obesity, incidence of obesity among kids, and lack of exercise and lifestyle. And this really is a major challenge, as our societies here in this region are quite young. And as the effect of diabetes is down next 15, 20 years, you are going to see a tsunami of complications unless something is done now and something drastic is done now. Comprehensive and logical with an involvement of the community, just to join what Dr. Schwartzstein has said. The other issue about This region I'm worried about as well. 1 out of every 3 women in childbearing age is at risk of becoming diabetic. And that has an effect on the baby, on the mother. And so the combination of results is rather discouraging.
Now, you know that in our Gulf area, we have 3 to 4 countries on the top 10, highest prevalence according to the International Diabetes Federation. Now, we all say that obesity is the highest in the United States. Why do you think we have more diabetes than, for example, in the United States?
Oh, it's a huge question. I wish we could have. The person who finds the answer would get a Nobel Prize, if there is a single answer. Part of it is genetic, I'm sure. Part of it is environmental. We talk about the thrifty gene hypothesis, whether it turns out to be true or not, I have no idea. But frankly, in certain populations in the United States, you find that prevalence more than others. So there are definitely some population and genetic influences that govern this.
You mean like
thing.
Hispanics
and the Pima Indians and these kind of population, you find more of these problems.
So it's not just lifestyle, it's lifestyle plus probably
lifestyle makes it worse. I mean, with lifestyle, you look at, for example, populations of Japanese who live in the United States and those in Japan, they tend to have different kind of ailments and diseases. So there is a lot of lifestyle interaction with the genome. The question is, how much is each doing and how does it express itself?
Professor Schwartzstein, now, in your institute, do you work with patients or only with physicians?
No, we work with patients as well, and we were talking earlier today in some of our meetings at the Dasman Institute about the role of nurse practitioners and other health professionals as part of the team in managing patients with these chronic illnesses. Nurse practitioners often have more time to spend with the patients, often get even a more intimate or close relationship with the patients as well. So I think managing these chronic illnesses really depends on a broader view of how we bring the team together to make this work. Nutritionists is another example, and particularly in diabetes, to train the patient and family about what's right to eat, what's not right to eat under various circumstances.
Now, Professor Kaldany, now in Joslin, as Professor Schwartzstein is saying, you have this type of teamwork.
Correct.
And tell us about it over years in Joslin, how it happened.
Well,
because this is something we'd like it to happen in our country.
Yes. Well, the merit and the vision started over 100 years ago with Dr. Joslin. He started the Joslin Clinic in 1898. And he was the first to realize, even before the era of insulin, that a diabetic patient needs to be part of the treatment. Otherwise, they don't do well. And frankly, he is the one who pioneered the importance of education for the patient and the family. And as things evolved, the teaching nurse became a vital part of the system. The nurse becomes a bridge between the patient and the physician and the clinic. At that time, he used to have the traveling nurses who would go to the patient's homes as well. Then nutritionists. So we have the integrated team approach right now, where the patient is is part of the team and has support from the physician, the nurse practitioner, the nurse, the educator, the dietitian, and the specialists as need be. So it's a very well integrated system, which is a pioneering. Everybody in the world now copies Dr. Joslin's recipe.
Yeah, and this have been lost for many years. It have been to be proven by studies that paramedical staff have been needed maybe in the 60s, and he was one of the guys who mentioned it earlier.
Much earlier, correct.
Much earlier.
Now it has everything plus with the ETDRS study, with the early treatment of the diabetic retinopathy study, they finally confirmed what he was saying from the beginning, that bringing the blood sugar as close to normal for the longest amount of time with improved control is the best way to prevent complications, and that study proved that he was right.